Good afternoon, ladies and gentlemen. Thank you for the committee for the chance for me to present my research. This time I will present my research with the title Characteristic of Traumatic Brain Injury in Sanglah Hospital, Bali, Indonesia, a retrospective study. I am Wayan Niryana from Neurosurgery Division, Department of Surgery, Faculty of Medicine, Udayana University, Sanglah Hospital, Bali, Indonesia. As we know from CDC 2014, 2.87 million traumatic head injuries who came to the emergency and inpatient unit. From National Basic Health Research 2013, 8.2% prevalency of injury data in Indonesia, highest in South Sulawesi and the lowest in Jambi. From Global Status Report on Road Safety 2018, death from traffic accident about 7% of the world population. 1.35 million people die due to traffic accident annually due to head injuries. From data of Haji Adam Malik Hospital Medan, head injury mostly occur at the age 18 until 35 years. The incident 150 until 200 people for 1 million population. But in Bali, there is no epidemiological studies available to date. So the purpose of this study is to describe the characteristic of traumatic head injury patient at Sanglah Hospital, Bali, Indonesia. This research is a retrospective study centered on Sanglah Hospital Denpasar as a single center. Data were collected from 1 January 2015 until 30 December 2017. Inclusion criteria were patients with diagnostic of traumatic head injury, and incomplete patient medical record data will be excluded from the study. The data that we collected review from medical records as demographic information, mechanism of injury, history of previous injury, type of injury, number and type of bleeding, 24 hours survival after head injury, and from pre-hospital status, history of unconsciousness before hospital admission, duration of unconsciousness, time intervals to the hospital, and from survey, level of awareness or GCS, condition of the presence of airway disturbance, sign of impaired oxygen circulation. The result is, from this table, we can see gender, male and female is equal. There is no significant significant difference. From the age is mostly patient with age 19 until 40 years. And there is a significant statistical difference. Become more than 40 years, the patient of count is more died. And from history of head injury before, there is no significant difference. And the cause of injury is mostly traffic accident. The history of unconsciousness, yes, most of patients have no history of consciousness who died after 24 hours. And duration of unconsciousness is most of the patient less than 10 minutes. The time come to the hospital, most of the patient came before 1 hour. And GCS on admission, most of patients came with mild head injury, GCS 14 until 15. But with the GCS become lower than 14 or severe and moderate head injury, most of them is become died, and that is a significant statistic. From this table, we can see most of patients, 69%, who came with oxygen saturation less than 90%, died. If we compare with there is no history of saturation less than 90%, and there is significant statistic difference. Most of patients with airway obstruction, 69% too, came and become worse. If we compare with 8.4%, there is no airway obstruction, and there is difference statistically. From the type of injury, most of patients came with blunt head injury. And from the number of types of bleeding, most of the patients come with one type of bleeding. But if we see from the multivariate analysis between independent variable and outcome, more than two type of bleeding, the patient have a worse outcome or become died after 24 hours. From the logistic regression analysis of mortality in the first 24 hours among traumatic head injury, that we can see most of them have a significant statistic, like age over 40 years old, there is 2.02 p-value, and then GCS less than 9, airway obstruction, intracranial hematoma more than 2 type, and time to hospital more than 1 hour. So from the age group, in our studies, head injuries were found to be highest in the 19 until 40 years age group, with the commonest cause of injury was traffic accident. Balestri et al. Found the age and outcome of head injury were highly correlated. Age 30 until 60 years have a higher mortality rate than younger age group. From gender, in our studies, the incident will occur more in male group, but there is no significant difference was found between outcome with sex. Bayer et al., men were more at risk of head injury and associated with occupational risk that have higher physical level than female. Liu et al., male compared with female in both young and elderly. In young, 10/1 and elderly 4/3. Munifen Ketapa et al., the quantity of head injuries and deaths was more common in female than male in pediatric and elderly population. Ma et al. Conclude that female as steroid hormones as neuroprotective effect. History of previous head injury. In our studies, there is no significant difference between history of head injury and outcomes. But Soviet et al. Found that 80% of head injury patients with history of minor head injuries were correlated with outcomes. Impaired oxygen and airway disorder. In our study, the existence of airway disorders and oxygen saturation less than 90% or PaO2 less than 60 millimeter mercury are significantly associated with the risk of death. Therefore, the need for adequately airway handling in traumatic head injury patients to reduce the risk of death. In our studies, we found that mortality risk was increased 5.65 times in traumatic head injury with presence of more than 2 types of intracranial hematoma. Meretz et al. Found that mortality rate was higher in older patients and presence of more than one type of bleeding. Our studies have limitation because we are in urban area, so unable to represent condition elsewhere in Indonesia. And this is a retrospective nature, so limited clinical information and medical report. Patient outcome were not assessed using Glasgow outcome scale. So we assess only by dead or alive after 24 hours. And from this research, we can conclusion this is the first study which described the characteristic of traumatic head injuries in Bali. Traffic accidents are mostly experienced by men and patients aged 19 until 40 years. Impaired oxygen distribution to the brain and other vital organ is the fastest killer in injured patients. The existence of airway disorders and oxygen saturation less than 90% or POU2 less than 60 mm mercury are significantly associated with the risk of death. Further research is needed with more than one research center, more sample size, longer time frames, and more variables to represent the characteristic of traumatic head injury patient in the province of Bali. Thank you very much for your attention.